For AV sheath removal, these are the items that we would need to pull to gather before we went to pull the sheath. So you're going to need a quick clot, a wedge, a suture remover kit, a box of 4x4s, and some atropine, and this the elastoplast tape cut in equal 3 segments, maybe 12 inches long, to secure this vessel here. So before you pull your sheath, you want to make sure that your ACT is less than 170 and that your blood pressure is less than 150, because you don't want to be holding pressure for longer than needed, because this you can't get hemostasis with this vessel. So the first thing you want to do is do hand hygiene, get your gloves on, and then you might also want to put a pulse ox on the toe so you can see the waveform on how much you're holding pressure. Okay, so you're going to pull the dressing off. And then you're going to check the insertion site, and then when you pull this out, you want to be able to hold pressure. When you pull this, you want to see a little bit of flashback there, because you don't want a clot to be at the end of that. And then you hold pressure above the insertion site so you can see the insertion site, so you can evaluate for bleeding. And then you want to also be able to look for a hematoma. So you're looking at the insertion site and observing for the hematoma. So then you're going to hold pressure here for 20 to 30 minutes. And then after you have that pressure, you're going to open up your quick clot and put that over this site. And then you're going to open your quick clot to put over the site. And then you're going to put your side over that, and then you're going to use your wedge to put over that. And then we're gonna secure that. Oh, I would usually put a towel, like a washcloth, over this part. So then we're gonna cover. And then go crisscross. Right, and so then you are looking at your waveform on this, and you're checking pulses here every 15 minutes for an hour, and then every 30 minutes for an hour. And you want to make sure that like when you first start holding pressure, you hold occlusive pressure for 5 minutes, and then you hold just enough pressure to stop the bleeding.
Feel a pulse.
Response. So if they drop their blood pressure with or without the bradycardia, you want to give a half an amp of this atropine and bolus them with 250 cc's of normal saline.